Second step that we should always remember is many times all diabetes are not the same. Some diabetes, majority of the diabetes which we see in the present world are type 2 diabetes mellitus. Now, what is type 2 diabetes mellitus? It means that in this patient there is the amount of insulin production is good, but there is marked insulin resistance, means the insulin which is being produced is not being able to be utilized in the body. So, because of which the insulin, though it is present, but it is not able to send the sugars into the body cells, and hence the sugar circulates in the blood and it causes all the symptoms of diabetes mellitus. Other type of diabetes is type 1 diabetes mellitus. In type 1 diabetes mellitus, there is no absolute insulin deficiency, means there is no insulin production at the level of the pancreas. The reason being autoimmune nature, means our own body cells, the white blood cells, attack the insulin producing beta cells of the pancreas and start destroying it. So, this causes an absolute deficiency of insulin, because of which there is no insulin circulating in the blood, and hence we are type 1 diabetic. Some sorts of diabetes are caused because of certain medications. Commonly used medications can be steroid, some antipsychotic medications. They can also cause diabetes. Another form of diabetes which of late we are picking it up is called latent autoimmune diabetes of the adult, where it is seen in adults. It starts as the presentation, at the time of presentation it may be type 2 diabetes mellitus, but in actual format after a period of 6 months we notice that the patient starts losing her sugar control and ultimately he converts into a type 1 diabetes mellitus. So, if we do not classify that we belong to which category of diabetes mellitus, what will happen? The most important challenge is that if we do not classify that we are which category of diabetes mellitus, the management differs according to the classification. Because if we are type 2 diabetes mellitus, the first point is that oral hypoglycemic agents, means the tablets can work, and in this the insulin requirement may be there depending upon case to case. But if it is type 1 diabetes mellitus, it means absolute insulin deficiency, then tablets won't work. The patient has to be on insulin therapy for lifelong. If he is if he is diabetic because of certain drugs, which can be steroid, which can be antipsychotic, which can be chemotherapeutic drugs, so during that, if the drugs can be considered to be changed, maybe his diabetes can also be reversed. And if it is sometimes like latent autoimmune diabetes mellitus of adult, which is called LADA, the management is little different compared to all types of diabetes. So, hence it is necessary that once we are diagnosed that we are diabetic, we should ensure that we should have ourselves known that we belong to which subset of diabetes mellitus, and does medications will work or not. Coming to type 2 diabetes mellitus, when the management issues comes to us, whenever the patient, when we break the news to the patient that yes, you are diabetic, the management does not consist only of medications. It is a triangular management of diet, exercise and medications. So, you can understand that all the three components has a predominant role in the management of type 2 diabetes mellitus. Many patients they feel that these drugs will cause us harm. So, number one point, anything that is taken by mouth, be it any tablet, be it any group, be it Ayurvedic, homeopathy, Unani, allopathy, every tablet has got its own mechanism of action. Many of the medications which are being used in modern science, they are thoroughly researched. So, the most common drug which is like used being metformin, that is derived from a French lilac flower. It is derived, it is purified and then used in the management of type 2 diabetes mellitus. So, each drug has undergone very series of clinical trials. Number 2, its safety has been well documented over years of use, and now once the the American Diabetic Association has made mandatory that every diabetic drug which is released into the market has to mandatory get a cardiology clearance, means it should show no bad effects on the cardiovascular health. So every drug has been thoroughly studied. So first of all is that if any drug is written, you should be free to discuss the things with your doctor, that what are the complications that you are expecting with this drug, is there that this drug is better suited to you, and all the doctors are freely available to talk. Further, all the matter available, if they are available through the Google search, every matter is there in the thing. Predominantly the tablets, majority of their tablets should not have any side effects. The another point is that when we talk about the mechanism of tablets, so there are broadly two groups of tablets that are used in the management of diabetes mellitus, type 2 diabetes mellitus. One category is called insulin secretagogues. Another category is called insulin sensitizers. Now, what do we mean by insulin secretagogues? Means these are the tablets which go into our body and they make the pancreas to work more and extract extra insulin from the pancreas. So it increases the insulin production in our body. So these group of drugs, the thing is that they can have little bit of weight gain. Another biggest point is because they are increasing the insulin production, if food is not taken at the right time, sometimes the patient can have hypoglycemia, means low sugars. So this category predominantly it belongs to the group of insulin and tablets like glimepiride, libenclamide. These categories belong to this type of drugs. Another classic group which is predominantly now the mainstay of management of diabetes, type 2 diabetes mellitus, is insulin sensitizers. Insulin sensitizers mean it does not increase the production of insulin from the pancreas in our body, but it predominantly works at the level of muscles, fat and the liver, where it increases the metabolism of the insulin, means it sensitizes the body and allows the body to utilize the insulin present in it without causing extra insulin production. These tablets are the mainstay, and nowadays all tablet groups are working on this phenomena. So the biggest advantage of this type of tablets are that if they are alone used, then the patient the hypoglycemia risk are less, they are weight neutral, or sometimes they can be even weight decreasing tablets. The third that we always see is insulin. Many apprehensions are there about the insulin. Number one point, that in today's world we are using human recombinant technology based insulins, which means that they are very close to the insulin which is already being produced in our body. So it is a very natural thing which is we are giving in the management of diabetes mellitus. This insulin is all presently available in India. It is available in the injectable forms, means it has to be injected in a self delivery mechanism pens, which are freely available in the market. Many patients ask that once we have started on insulin, should we continue the insulin lifelong? Now this is not the right answer. Insulin is used depending upon conditions, and not in all the cases it is true. In many times when there is a operative period where we have the patient is going operation, where the patient is having active wound, where the patient is sick, at that time we cannot use tablets. So we have to use insulin. So at that time, once the patient recovers from these things, insulin is stopped. So this is one of the examples where insulin is used only in the emergency purposes. Further, sometimes the sugars are so high that the tablets may not work initially, but once with the use of insulin and the sugars are better managed, the patient can be switched over to tablets. So first, insulin is one of the most natural remedies because it is the same thing what is being produced in the body. Number two, the thing is that it is not true that in all cases that we continue the insulin lifelong. So the another point, that the thing is that if we keep on eating the rice is the only cause of sugar. It is not only the rice, anything which is eaten in excess quantity, that is difficult to metabolize without doing exercise or thing, they can cause elevation of sugar. So it is not that rice is the only culprit, but yes, because rice, number one, whatever the rice we eat is a polished rice where it does not contain any amount of fiber. So because it does not contain any amount of fiber, the digestion is very easy, and because the digestion is very easy, immediately it is absorbed in the blood and the sugars get elevated. So concept is that it requires very minimal amount of digestion, very little amount of work to the stomach to get digested, and hence it is considered relatively bad in the management of diabetes. But it is not that if we avoid rice, we will not get diabetes. No, that is not the truth. Another thing is that in patients ask that once we are diabetic, we should not eat fruits. No, it is not the truth. That certain fruits are not allowed, and that certain fruits are not allowed because the reason is again that they are very high energetic value. Number two, they don't require any work from the stomach to get digested, and the moment they go into our blood, they are immediately shifted into the blood as high glucose level. So it means that the time for the digestion is so less that immediately it gets absorbed into the blood and it is circulated as high sugars. Apple, green apple, orange, watermelon, pomegranate, these fruits are allowed. So papaya. So please don't be under the impression that a diabetic patient should not eat fruits. Yes, he can eat fruits, but there are certain limitations which can be discussed with your doctor.